Hi, and welcome to Something to Talk About. I'm Linda McNamee, and for the next hour, as you saw from our introduction, we are going to talk about how you can stay safe and help others stay safe amid this COVID-19 pandemic. Seems like it's been lasting forever, and hopefully, I know everybody wants to get it over with. So hopefully by the end of our conversation tonight, we will know ways of, helping the community as a whole. But before I begin, and before you meet our wonderful guests, I would like to thank Chris Flaherty for helping me with our hybrid episode, because we want to keep everybody safe, especially our guests. And thank you, Chris, for keeping the show going throughout this entire pandemic. I miss the rest of the crew. Hopefully you will be back in the studio soon. And I definitely want to thank my husband, Paul, for staying home for daddy date night. Hopefully the kids have finished their homework by now. Anyway, okay, business aside. Yes, we are not live this evening, so you will not be able to call. However, you can always email me with your questions or a suggestion for a future topic at talk@bcattv.org. So if you do have a question and you miss our guest email, you can always email me and I will make sure that they get the information. So joining me this evening, virtually, we have Susan Luminello, sorry, Susan, who is the director of the Burlington Board of Health. And we also have Dr. Ed Weiner, who is the chairperson of the Burlington Board of Health. So welcome, lady and gentlemen. Thank you for joining me. We have a lot to talk about. So before we get into the topic of COVID itself, can you each give us a little idea of where you grew up, how you came to the Burlington area, and how you got involved in Burlington's Board of Health?
So I'll go first.
Ladies first, why not?
I grew up locally. I grew up in Woburn, and I moved to Burlington about 25 years ago with my family. Raised my children here. I've been here ever since. And I started my career in environmental science. So when I joined the Board of Health in 2010, my background was in environmental consulting, and I started as the environmental engineer for the Board of Health.
Wow.
And then in 2012, I moved on to become the director of public health.
All right. And Dr. Weiner, how about you? What's your story?
I came to Burlington about 33 years ago.
Where did you grow up?
We saw in the newspaper that the Board of Health was looking for candidates. And my wife said to me, "You're an expert in some of these areas. Why don't you go run for office?" And I said, "I don't know what they do." But the next thing I found out what they did, I went to town hall. In fact, I had to look town hall up in the phone book to find out where it was. And Jane Shue, who was the town clerk at that time, said to me, "Who are you?" And I told her, and everybody was happy. I have been on the board now for almost 32 years.
Wow.
So I didn't spend very much time in Burlington without being on the board. So I have been here 32 years, and I'm just as excited and just as involved as I am in this community as I was 32 years ago.
Excellent.
At the time, I was a tenured professor at the UMass Lowell. Subsequently, I left and I went to industry, where I became a director of medical affairs for a tiny drug company, tiny pharmaceutical company, which turned out to ultimately grow to 62,000 or so people.
Wow.
And that was AstraZeneca Pharmaceuticals. I am now semi-retired and doing consulting around the country.
Excellent. So what's the difference between the staff and the board? Because aren't both kind of boards, Board of Health? How does that?
There are 5 elected Board of Health members.
Okay.
David McSweeney, who is my vice chair, Dr. Wayne Saltzman, who is an elected member, as is Libby Wallenjevitz and Mary Beth Welch. All of us are elected. We are the elected board, and we have a multiple number of agents and groups that report to us. We have a director, who I have said many, many times is a hero within this community because she does so much, especially in this pandemic. She's our director. We have an environmental engineer who works in a lot of different ways, but predominantly works to ensure that this community, which was once quite a bit polluted, is now being cleaned.
Excellent.
And this community is not far from being totally clean. We've got a long way to go, but we very much into that.
There's always
We have
work
a
to do.
health agent. She's in charge of many of the food inspections, food, for instance, the restaurants, the supermarkets. She handles all of the food, as well as a lot of other licensing groups, as well as a secondary health inspector, an associate health inspector, which helps her. We need those people because we've got over 100 food establishments in this community.
Wow.
What did I leave out? Oh, our supervisory nurse. We have one nurse in this community in public health. She is always involved. She's involved in education. She's involved in communicable diseases. She's involved in all of the programming in which people need to be vaccinated. She works with the schools. She has so many diverse duties that she has to do. So that's the Board of Health. And in this pandemic, with seeking another position, people say, well, what did the Board of Health does? So maybe before I go into
Well, that's why we're here.
We talked about environmental. Very important. We haven't talked about development. You know, we're a town and we have elected Board of Health members. And there was somebody called Paul Revere in the 1700s. And
I think I've heard of him.
He was one of the first, if not the first, public health official in this country. Actually, prior to this country, he was the first public health official. It's a long story, and it's even partially legend. But he was, and he felt that elected boards of health, including within towns, including within the town of Boston, that these Board of Health should have oversight over everything. And you wouldn't expect that the Board of Health has oversight on development and redevelopment, but that's a big piece of what we do. Under the Subdivision Control Act, actually, the Board of Health controls that development, site plans, special permits. Almost everything that gets built in this community has to be in some way approved by the Board of Health. And new steps, we're moving from an office-based community to biotech.
Okay.
And we play a major role in the biotech industry within this community. We have to approve everything that goes on.
Okay, so what is
For
this
the 100
position?
food establishments, as we talked about, everything from supermarkets to the many restaurants in this community. And we have to do multiple inspections every single year, at least 2, as well as respond to many complaints.
So
What can I say about the public health nurse? She's involved in everything that we do, involved in the clinical part of the Board of Health, from the health fairs.
Okay, so what would be the position that you're looking for?
Yeah, let me get to that.
Okay. We only have an hour, and I want to talk about, COVID. So.
Yeah, and right now, on top of everything we have to do to keep us so busy, on a good day, COVID was dropped in our lap.
Okay.
Susan Luminello and my staff are working 7 days a week. Susan hasn't had a weekend off in months. She even had a death in the family 6 or 7 weeks ago and still had to work that weekend. We've had so much to do to keep this community well and keep this community safe. We respond to so many complaints. We respond to so many, what can I say, orders by the governor and by the Department of Public Health. We work with the schools. We work with so many companies, all to do one thing, is to keep COVID at bay in Burlington. And because of that, because we're so busy with that and so busy with everything else, especially in redevelopment, especially as we move towards biotech, and in the middle of this COVID pandemic, we are out straight. And we are asking town meeting in January for an associate director of public health for this community. Even when COVID is done, even when hopefully a year from now or so, that there is no more COVID and we're back to as much normalcy as we can, we're still going to be extremely busy. Burlington is a very diverse community in all ways. We have so many international headquarters here, so many large companies here, and so many new companies here, as well as every time you turn, a new restaurant, a new food establishment.
Definitely are growing.
We need the help in Burlington. So that's where we're going. And I'm sorry I get carried away a little bit, but I'm working many hours a week also. Susan will tell you, it's probably not my role to be doing so much in terms of day to day. However, she's a taskmaster. And all our Board of Health members are working very hard because we're all out straight. These are exceptional times, extraordinary times.
So recently, the Board of Health had a flu clinic, and it was drive-through at the high school. Well, you've been doing a flu clinic every year. And I think this year, there seemed to be more stress on the flu clinic itself. For instance, in the public schools, it didn't used to be a requirement for all students to have the flu vaccine, but this year it is. So can one of you, either Susan or Ed, talk to me a little bit more about how this year's flu clinic went and how it compares positively or negatively to previous years?
Let me set it up and then Susan can take it from there.
Okay.
We are blessed in this community with a medical reserve corps, which is directed by the Burlington Board of Health. This was put together around 15 years ago by our board. I was involved as well as many other individuals, but we developed the Medical Reserve Corps. And then we took it a step further and we broke away as an independent Medical Reserve Corps in the Commonwealth of Massachusetts. We were very lucky to have 50 or 60 volunteers of approximately 180 that we could have mobilized within this community.
Wow.
Susan, you can take it from there because you directed it.
Okay. So one of the things that the Board of Health is mandated to do by the state and federal government is to have an emergency dispensing site plan. And in the past, that plan has always talked about an anthrax attack and getting medication out to the public should something like that happen. So our planning for a long time, that was the scenario around it. And we've had the emergency dispensing site plan for years. Recently, in the past 2 or so years, the federal government has been pushing more along the lines of emerging infectious diseases like COVID, something that we're not expecting to happen. So we just started our planning for that, and then came COVID. So this year, when we had to do, every year we've doing, our flu clinic is an emergency dispensing site drill.
Okay.
And we use the flu vaccine to do this drill. So this year we had to change it all around. we did a drive-through component for that to keep everybody safe. So we changed our emergency dispensing plan and put an addendum to that, which included the drive-through portion. So you're correct in that it was very different. We had to have a lot more partners involved. We had the police involved, we had fire involved, we had the school facilities involved, we had to rent more equipment, we had to get more supplies. Usually we do have about 50 Medical Reserve Corps volunteers help out at emergency dispensing sites.
Okay.
We had the same thing this year. One great thing that happened this year is we had a lot more dispensers. So we had about 18 medical people dispensing vaccine.
Okay.
We were able to run 2 lines, and I think it went very smoothly considering this was our first one. And this was our practice. This is our practice to give out COVID vaccine if we needed to do it.
Okay. Now, with the drive-through component, was it just adults, or did you also have like the under 18 or under 12 or the child or the juvenile components as well?
Yes, it was for adults and children. Yeah, and we had dispensers in both lines that could do children. Children take a little bit longer. Sometimes you have to pull over. They have to come out of the vehicle. We don't want to be chasing any kids, in the back of vehicles. So they had to come out and sit down, and we vaccinated them that way. So we did both adults and children, and I think was at over like 500 vaccines we gave out in about 3 hours.
Wow. Because I know you must have had extra traffic coming through, because I know that I had called my primary care physician as well as my children's primary care physicians, and they're like, no, we're not scheduling any appointments just for the vaccine. You have to go somewhere else. So I'm just thinking that must have increased your popularity a little bit.
Yeah, well, the new that's different this year is that children are required to have the flu vaccine for school.
Okay.
And they have to have it by the end of December. So if anybody still is not vaccinated, we still have vaccine left. So they can call the Board of Health office and make an appointment and come in and get their vaccine.
Excellent. Now, do you work through insurance companies, or is this like funded by the town, or how do you manage to acquire all of these vaccines? Because they're not free.
No, so some of it is state supplied, and that's for children. So if we vaccinate children in a flu clinic setting, those are supplied by the state. And we also privately purchase vaccine and have a revolving fund. And if you have insurance, we ask you for insurance and we get reimbursed for it. If you don't have insurance, that's okay too. You still get the vaccine.
Okay, now because children are required, are children going to need vaccines every year moving forward? Or why is it more important this year? Because the flu vaccine does not help COVID at all, does it?
So you can, because the flu mimics symptoms of COVID.
Okay.
We want to make sure everybody gets vaccinated so that we don't, and because we don't want COVID and flu at the same time.
Okay. No,
so
that
I don't know. I don't know what the state is going to require next year. If this is going to continue or not, we haven't heard anything to that effect in either way.
Now, is the town doing any COVID testing, or is that strictly somewhere else?
Right now, we have not done any COVID testing. We don't have any plans to do that at this time.
Okay.
There is free testing sites in Massachusetts. If you Google MA Stop the Spread, there's, I believe, around 18 free testing sites in Massachusetts that people can go to.
Okay, that's good to know. Now, throughout this pandemic, we keep hearing about, social distancing is like the new norm, but we've also heard terms like isolation and quarantine. So are those synonymous? Are they different? What do each of those terms actually mean?
Okay, so they're not synonymous. Isolation is for people who have tested positive and or asymptomatic. And quarantine is for people who have come into close contact with someone who tested positive and now needs to stay home. So that it's a little bit different. Sometimes people can start out in quarantine, and then if they become symptomatic or if they test positive, they then go into isolation. So there's different protocols, different time frames for when you come out of isolation and when you come out of quarantine. So if somebody tests positive for COVID in Massachusetts, they should be getting a phone call from their local Board of Health or from the Massachusetts contact tracing team. And we do an intake. That's what our supervisory nurse does. And right now we have other staff working on it, and we've had our medical reserve corps people working on it. So they ask questions about your symptoms, when you became symptomatic, and do a complete intake and ask you about who your close contacts were. Close contact means who you were within 6 feet of for 15 minutes or more cumulatively 2 days prior to either when you became symptomatic, or if you're asymptomatic, 2 days prior to when you got tested, because that is your infectious period.
Oh, it's only 2 days?
2 days prior.
Okay. Because originally, weren't they saying that it was like up to 14 days before you became symptomatic?
14 days is the incubation period. So if you were a close contact of someone, then you could become symptomatic or test positive anytime within the next 14 days. That's why the quarantine period is a 14-day time period. And that is also why you cannot test out of quarantine. So if you get tested, on day 5, you could still become symptomatic or test positive on day 7 or 8.
Okay. Wow. So
without contact tracing, and without quarantining and isolation, this pandemic could really get out of hand.
More so than it is now?
Well, if you've seen where there have been some parties at colleges where 4 or 5 kids were infected. They go home to their state and they infect dozens and dozens of people. We saw a wedding. I can't remember where it was. A wedding.
I think it was in Maine.
It was in Maine, where a number of people who were infected took it back to their families. And a number of people died who never went to the wedding. So this is so important that we contact trace, so important that we take these people who may be spreaders out of the population. And I think we mentioned it. Just today, 2,744 people in Massachusetts are positive, new today. And we have an estimated amount of cases in the 33 to 34,000 range in this community. Think of what would happen if those people were just out and not quarantined and spreading it.
One other thing too, I'd like to remind people is if they are symptomatic and they feel they need to get tested, they should stay home until they get the results of their test. So, or if they were a close contact of someone, if you know you're a close contact of someone and you're going to get tested, even if you are asymptomatic, you should stay home until you get the results of your test.
Okay. Now, another thing about the testing is both of my children, they're kids, they do have some symptoms that may or may not be COVID related, so they do get tested. What is the difference scientifically or accuracy rating between the rapid test, where you can find out the test results in like an hour or two, versus the other test, I don't even know what it's called, that takes like 2 to 5 days?
So there are molecular PCR tests.
Okay.
That's the test that we want you to get. And there are antibody and antigen tests. That's the test where we would prefer that if you do get that test, at the same time you get a molecular PCR test. So either one of those tests can be rapid. So you can get a rapid molecular PCR test and you can get a rapid antibody test. So that's not going to tell you whether or not it's the correct test. You need to ask whoever's providing the test, is this a molecular PCR test or is it an antibody or antigen test?
Okay, so you definitely want the molecular one because
Molecular
it's more accurate?
PCR.
Molecular
It's a more
PCR.
accurate, yep, it's a more accurate test. Now, if you get an antibody or antigen test and it comes out positive, we are going to assume that you are positive unless you go and get a PCR test. So we do recommend to people who come in as probable cases, those are people who are positive on an antibody or antigen test, to go back and get a molecular PCR test, because especially if they're asymptomatic and they haven't had close contact with anybody, there's a chance that they would be negative on a PCR test.
Okay.
And I can tell you, I had a molecular PCR test about a month ago, and the results came back within 20 hours. And that was the state program test, the test that falls under Stop the Spread.
Okay.
So, and Stop the Spread program is run absolutely beautifully. They just do an outstanding job. You drive up, they test you, you come home, and by the next morning you have results.
Wow. Okay. I know I didn't talk about this in my questions specifically, but I'm still hoping we can address it a little bit. The cases in the schools. I know there have been a lot of probable cases. I know you, as well as Dr. Conti's office, has been amazing getting the information out to families about possible cases, probable cases, confirmed cases. But in the middle school, it seems like a third of the 8th grade class is now in quarantine. So how do you go about making decisions about moving students to virtual versus keeping them involved in just more contact tracing? And then what's the threshold to shut down either the school or all of the schools?
So I don't know if there's a particular threshold. I think what we have to look at is to see if we have school-based spread. So if we're seeing within like the schools that we have one case connected to another case, connected to another case, and or perhaps we don't know where these cases are coming from. We haven't seen that yet in the schools. And when we make the decisions to put people on quarantine, there's a difference between, so the school has developed a policy where if they have a positive case in an elementary school or the middle school and the child was in school during their infectious period, to have their class go remote for 2 weeks from when that child was in school. Now, that doesn't mean that everybody in the class is a close contact and is on quarantine. So the Board of Health is the one that would call you if your child needs to be on quarantine, because we would determine based on who was sitting around a child or who came in close contact with the child, whether or not that person needs to be on quarantine. So just because an entire class has gone remote, it doesn't mean that everybody's on quarantine.
Oh, okay. All right.
It means that they close the class down for remote for a little while, and some of the people in the class are on quarantine. The difference being, if you're on quarantine, you need to stay home.
Got it. Okay, because I know, again, social media can be a good thing, social media can be a curse. So I just wanted to kind of clarify that for myself as well as my audience who oftentimes relies on social media for their news. So during this pandemic, we've seen colors, so like red versus yellow versus green, depending on the numbers. And Burlington seems to have stayed yellow. But when and how do towns switch from one to the other? And how is that determined?
Yes, so right now you're correct. Burlington is in the yellow. We have been in the yellow since last week. On November 6th, the Department of Public Health changed the way they calculate the green, yellow, red categories.
Okay.
So it was changed based on population. So for a population size of 10,000 to 50,000 people, where Burlington falls into, yellow means that you need to have 10 or more average daily cases per 100,000 in population, or a positive test rate of 5% or higher. So right now, Burlington does have the 10 or more average daily cases per 100,000, but we do not have the positive test rate of 5% or higher. Last week, our positive test rate was around 2%. This week, it's hovering around 3%. To move up into the red, you need 10 or more average daily cases per 100,000 in population and a positive test rate of 5% or higher. So if we continue with the amount of cases that we're having and our positive test rate moves up to the 5% or higher, that's when we would be in the red. In order to get down into the green, we need to have fewer than 10 average cases per 100,000 in population and more than 10 total cases. So right now it really is based on the percent positivity. If our percent positivity moves up to 5% or higher and we continue with the cases that we have, continue seeing the amount of cases that we have been seeing, then we would move up into the red.
Okay. Now,
and what that means is, although they report out colors once a week, these numbers change all the time. There are people who will come off and people who come in based on the time that they have had in isolation or within positivity. So the key here is that things go up and things go down based on our community, and when they have gotten the COVID-19, and when they fall out of the window and they may come off. So things change basically daily, but we report it weekly.
Okay. Now, with that 5% positivity rate, does that also count people who are retested to make sure that they are no longer affected by, immediately affected by COVID?
For the most part, people are not retested. Once they test positive, they fall within the guidelines and within the protocol. They don't go back and get retested, at least not at this time.
Okay.
Yes, that's correct. Yeah.
Okay. I had heard that people have, once they've tested positive, they have to get retested to make sure that they're negative. So that's just...
So maybe you heard that in the beginning. So when this first started,
it was
one
like
of
April.
the things that was required was that you need 2 negative tests to come out of isolation. The problem with that, we found, was that people were testing positive for a really long time.
Yeah.
So even though you have had COVID and you got better, you could still have, and you're released from isolation, you can still have a positive test, like maybe a month after you're recovered and you're out of isolation.
Okay, so that's no longer the case. Okay.
Right. So now we use different criteria to come out of isolation. And that criteria is 10 days of isolation, 10 days, provided that your symptoms are gone and that you have been fever free for 24 hours.
Okay.
So that's why if you're on isolation, the Board of Health is going to call you and see how you are and check up on you and see if your symptoms are resolved
Okay.
to release you from isolation.
So no little ankle bracelet to make sure you stay home. Not yet.
No. But we hope everybody is doing the right thing.
I hope so too. Now, we talked a little bit about the schools. Now, I'm kind of curious about businesses. And how are Burlington businesses responding to the pandemic? You know, with the mask wearing and the social distancing and food preparation and all that kind of stuff. How are they doing and how are you checking up on them?
So the state has put out many COVID-specific sector standards. So we have them for restaurants, we have them for retail, we have them for offices, we have them for theaters and performances, we have them for sports, there's so many different categories of sector specific standards for COVID.
Okay.
So at the Board of Health, myself and my staff, we need to be very familiar with all of those sector specific standards because we assist businesses in trying to comply with them. Not only businesses and sports leagues and theaters and wedding receptions and groups and everything. So we are very fluent on all of the standards. And we assist them in making sure that they comply and that they understand the standards. If we do take complaints, so these standards are enforceable by the Board of Health, and it is our responsibility to make sure that it's happening, that these different sectors are adhering to their required standards. But we can't be everywhere all the time. So it is complaint based. And we get complaints from the Board of Health. People can email us, they can call. There's a number for the state that they can call. And when you call the state, what happens is they send it down to the local Board of Health. So we are responding to all the complaints that come into our office and making sure that everyone is adhering to all the standards.
And we get complaints. We get complaints every single day. We get complaints from coworkers. We get complaints from people who go into grocery stores and into every type of business that you could possibly believe. We get the calls. And we follow up on every single call that we receive. And some of them are real and some of them can be explained. But I have to tell you, this community is trying to do the best they can. And I think it's partially because we have a great community and partially because we are so adamant that we are going to keep these standards to the highest level in our community to keep everybody safe and well.
So what happens if you do investigate and follow up on some of these complaints and you do find businesses not conforming to the rules and regulations? Is there a fine? Is there a 3 strikes you're out? I mean, what happens on the negative side?
So there can be a fine. That's not what we want to do. We don't want to fine everyone.
Okay.
So what we first do is we try to work with them to help them to comply, to help them to understand the standards, because that's not what we want to do, especially now. So we want everybody to kind of understand their responsibilities. I mean, if we had to fine someone, we could, but we feel that we need to have the discussions first. And I will tell you, we don't have a lot of repeat complaints. So we're doing well that way. We have some, but not a whole lot. And one other thing that we do that I want to mention is when we help businesses in the community, we're also helping them if they have positive cases. So all businesses in the community, if they have a positive case in their place of business, they're required to notify the Board of Health. And that is so that we know and what we can stop any cluster events before they happen, number one.
Okay.
So, but it's also to help those businesses do the contact tracing, make sure the people that shouldn't be in work are not in work and are at home quarantining, and working with them to help them understand what they can do to prevent an outbreak in their place of business.
Okay. That is good to know.
I think that we prioritize education. I think that's so important that these companies understand what needs to be done. And I've got to tell you that all of the standards that come through the state, some of them are pretty complicated. And each sector has different standards. The standards, for instance, at gymnasiums and health clubs are so different from office space. They have to understand what has to be done in their specific workplace. And it's not necessarily easy to do because they hear so much on social media. They hear so much coming from the governor and from the Department of Public Health. And then much of the issues that we have is, well, we just heard this, so we're doing this. And really, that's not where they are falling in terms of their compliance. They need to be compliant under a totally different set of standards.
Okay. Well,
one other thing too is the standards are always changing. So they're constantly being updated and changed, and they're responsible to know, as well as we need to know, is what those changes are.
Okay.
So sometimes that can be a bit challenging. They may not realize that a change has been made.
Well, since the virus itself is so new, all the experts are constantly learning about it, so I can understand that the standards need to change, the protocol needs to change, because you're learning more about what is working and what's not. So speaking of what is working and what is not, everybody's told, stay 6 feet away from each other, wear a mask, socially, wash your hands, don't touch your face. Are these still working? I mean, are those the best practices?
Yes, those are the best practices, and we need to continue with them. So we need to continue with socially distancing and staying the 6 feet away if we can. And if we can't, wearing the mask, even if you can, and that 6 feet distance, if you can keep that 6 feet distance away. So wear the mask all the time, try to keep the 6 foot distance. With regards to quarantine, people sometimes get confused because they say, well, even though I was within 6 feet of someone, I had the mask on. Well, it's great that they had the mask on and they need to continue to wear masks, but that is not 100% prevent it. So you would need to still be in quarantine if you come within 6 feet of someone. The mask is going to provide protection. It's going to provide, hopefully, the person will not get the virus because they had the mask on, or maybe they might not get it as bad, but they still do need to quarantine
because you don't know.
Have the mask on.
So you don't really know.
If they're in close contact with a positive person.
Okay.
Yes.
No,
the big fear right now is pandemic fatigue. We talk about masks. We talk about 6 feet distancing. We talk about washing your hands and not touching your face and doing all of these things, but people are getting tired.
Yeah.
We see it more and more and more. We have to stay vigilant. No matter what we do, we have to stay vigilant. How many times do I see people out in public and their mask is around their neck, or their mask is below their nose, or They run back to their car because they forgot their mask. Or every once in a while, you see somebody in a public place without a mask. We're seeing more and more of that. We have to stay vigilant if we're going to beat this pandemic.
And I think the important thing is to remember is we have to use all of those methods: the mask, the distancing, the hand washing, all of those methods together.
Okay.
And understand, the governor said today, he warned everybody to only have Thanksgiving with your immediate family. That's a pretty tough order. And how many people are going to do that?
How do you enforce it?
You can't enforce it. It's a hard thing to do. Christmas is coming up. The same thing. Christmas is the most important holiday of the whole year for the Christian community. How are you going to enforce it? How are you going to say, don't have your brothers and sisters over, don't see your parents and grandparents? You have to do what you need to do to stay safe. And you have to do what you feel is comfortable. I think Susan has said that many times. But we know what you have to do. Mm-hmm. And I'm not sure you can do it, but I think we got to try and to do as much as we possibly can.
I do have another question that kind of backs us up a little bit. But talking about quarantining, we're always talking about quarantining ourselves or socially distancing ourselves. But I know earlier in this pandemic, people were contact-free delivery, quarantining your groceries for, of course, non-perishables, quarantining your groceries for 24 hours before bringing them into the house. The library quarantines your books for a week or two before putting them back in the stacks. Has research determined that this is actually necessary, or are we just being overly cautious? Are we being paranoid? Where does that fall?
So I haven't seen anything from the CDC for quarantining groceries. I know that the books, that is something that is in the standards for libraries. Okay. So libraries have their own standards.
Okay. So that list of standards.
The library needs to do that because of the standards.
Okay.
So I haven't seen anything with groceries. I think it all comes back to hand washing. You want to always make sure, that's why we say frequent hand washing, because we're touching surfaces, all kinds of surfaces all the time. That's why it's important to be vigilant about washing our hands.
Okay.
And if you can't use disinfectant, something that's 70% or plus or minus of alcohol. Wherever I go now, we're washing down our hands before we go we come back out. There are dispensers everywhere. There are dispensers to clean the handles of your shopping baskets. We just can't be complacent. We've got to do it. How many times do I have to hear from my wife saying, I've got alcohol in my hands all day long and they're starting to sting. I tell her, think of what would happen if you didn't do it. Right. What is the alternative? And that is hand washing, not only for COVID, but for also the seasonal flu and for even the common cold. For millennia, hand washing has been the first level of defense.
Okay. Now, speaking of, yes, we have to remain vigilant right now during this pandemic. How much, once the pandemic is over, once we have a vaccine, not that we're going to return to normal, but do you see these practices continuing almost infinity? Like, will we always have to be wearing masks? Will we always have to be socially distancing? Is this just training for forever, or is this just going to end when the pandemic ends?
If you've watched a Board of Health meeting, we have been saying for years now in our closing remarks, please wash your hands. It is the number one defense that you have. Every Board of Health meeting, please wash your hands. What about face masks? I've traveled the world. When you go to the Orient, everybody has masks on. Other places in the world, they have used masks forever. Are people in the United States going to wear masks? I don't know. But I'm also going to tell you that this pandemic is not going to be over next week. Even if we have a vaccine, it gets very complicated. For instance, as I mentioned to you earlier, only 45% of people in the United States get a flu shot. I hope that that percentage is going to be higher when we get a COVID vaccine. We're still in phase 3. Moderna, Pfizer, all of those companies, dozens of them that are all working on vaccines. I can tell you they're in phase 3. They have not yet been approved. And once they get approved, and once they start to gear up and to start making vaccine, it's still going to take a long time.
Right.
Because you may not be able to obtain that vaccine for months and months and months. We don't know yet.
Right.
We heard today that at least one of the companies is starting to make 10 million doses. 10 million doses with a world population in the billions is really not going to do it for a while. And even if it was available, some of those vaccines need a second shot. And we don't even know if there's going to be mutations where you're going to need the vaccine every year. We are in a learning mode, and we're in extraordinary times. At least we're moving in the right direction.
Okay, well, we are almost out of time. We only have a couple of minutes left. So I kind of want to end on a happier note. I know we've been talking about physical signs and physical symptoms, but I know mental health has really taken a beating over the past 9 months. And like Dr. Weiner mentioned, that fatigue is setting in. How are some ways psychologically we can stay positive and get through this? Any advice?
We're a resilient country. We're a resilient people. We have gone through pandemics before. I hate to draw an example. 1918, we had the Spanish flu. We have other serious situations in this country, and we're resilient. I think we need to do what we know we need to do. Think we need to look at the brighter side. I wrote an article for a newspaper in Nevada and said, I'm on the phone every day calling people I haven't heard from in years, and they're so happy. I'm home, I pick up the phone, I call these people, we're able to reconnect with individuals. I urge you, call a senior citizen, somebody that you know has very little family, make them happy. Every time I pick up the phone and call somebody who is elderly and I know hasn't heard from many people, they're so happy to get the call. But I think we need to be positive. And I know so many people are depressed. And I know that this is a clinical situation. And I know it's difficult for everybody. But I don't know what to say except smile and say, we are resilient. We will get through this. We will go back to normalcy at some point in our lives.
I think one thing that we need to remember is that we don't need to lock ourselves in our houses. I mean, we can still go out safely if we wear a mask, if we try to keep our distance from others, go out, take a walk, do the types of things that you still enjoy doing. Don't, try to continue with those things in a safe way. That's why we have these standards, so that we can continue to keep places open, and keep people active and continue to do things. And you can still see people. Just keep your I like to call it your bubble, your circle of people small. Have a certain amount of people that you see and continue to see them. Like I have family, my daughter who doesn't live with me, but I'm going to continue to see her. And, we're going to continue that, what we need to do to keep ourselves happy throughout this as well. So we need to remember that we still should do those things, and but we need to do them safely, and we may need to do them differently. So one thing that you could do, if somebody is not in your smaller circle, see them virtually, or like Dr. Weiner said, give them a call. There is also a lot of resources available. So if somebody is feeling down or anxious, you can call 211 and ask about the resources that are available through the state if you need someone to talk to.
Excellent. Well,
Just as a closing, the Commonwealth of Massachusetts Department of Public Health is providing counseling to public health officials and boards of health because of the stress that they have been under.
All right.
And it just says it all.
Well, we are out of time, so I definitely want to thank both of you for coming to me virtually this evening and helping me and my audience, or our audience and our community, learn more about this pandemic and how we can get through it and why decisions are being made the way they are. So thank you very much. And I also want to thank everyone at home for tuning in this evening. I hope that you've gotten something out of our conversation. I know I definitely have. And I hope you have a wonderful holiday season now that it's just beginning. And I will see you around town. Stay safe. Good night.